Order, order. Well, welcome everybody to the second of the Environmental Audit Committee's panel events looking at the issue of air quality. I'm delighted to say that we have an excellent panel with us to help us through this inquiry. If I could firstly invite the panellists to introduce themselves, the organisation that they represent, and the particular areas of interest in terms of our investigations that they're going to be able to help with. So if I may start with yourself, Dr. Holman.
My name's Claire Holman. I'm the president of the Institute of Air Quality Management. I work for a small environmental consultancy called Calico, and I've done a lot of work in the planning system, which I know is of interest, the relationship between air quality and planning.
Dr. Fuller.
Hello everyone. Firstly, thank you for inviting me along. I'm Gary Fuller. I'm an air pollution scientist at Imperial College London. My interests really are mostly in urban air pollution, how it's changing and how it affects our health. I should probably say that I'm a member of DEFRA's Air Quality Expert Group, but I'm not speaking on behalf of the group today. I was with Suzanne Bartington, who's just behind me, one of the UK Clean Air champions, and I think you met Stephen Holgate at the last session as part of our group. And I should also, for full declaration, say I also write for The Guardian on air pollution science.
Goodness, thank you very much.
Good afternoon. Again, thank you for inviting me to speak. My name is Kieran Laxon. I am also at a consultancy called Calico, and I'm also the Vice Chair of the Institute of Air Quality Management. I am also on the Clean Air Advisory Panel for the Welsh Government and the Scottish Advisory Panel as well, which is why it's nice to be here talking about England today. My expertise, a lot of it is to do with modelling, dispersion modelling, and also in planning and assessment as well.
And just explain what the Institute of Air Quality Management is, Mr. Laxon.
So the Institute of Air Quality Management, or IAQM, is a professional body representing practitioners in air quality. There's over 700 members, people that carry out air quality modelling and dispersion modelling and assessment, lots to do with planning system, and they produce guidance documents for members and for others to use as well.
Thank you very much. Well, Dr. Fuller, if I can start with you. We heard in our first panel event about the major sort of pollution sources, and we talked about urban and rural air pollution. But can you talk us through what you see as the most misunderstood pollution sources, and which sources tend to be missing from pollution inventories that we look at?
Yeah, I think when it comes to pollution inventories, I think it's a bit of a misnomer, really. If you think about inventories, you think about perhaps stock taking, how many widgets you've got on the shelf or something like that, whereas in fact these are all models. So there's lots of uncertainties in each of the pieces of information that go in there. So for instance, for wood burning, you may know the emissions per fireplace, the number of hours that they're used and the number that are in an area, and that's how you work out the total. So, having said that, there's also some tension as well between many of the inventories. The national inventory is done on a national level for compliance with EU and, formerly EU, but Gothenburg Protocol and other things. So it focuses on getting national totals. Whereas when it comes to local air quality management, we really need to know about what's happening where we are. So those are really tensions there. Some of the things that have been done more recently to try to improve this, there was a project that we looked after in the Clean Air programme that sought to address some of these things by putting concepts in inventories such as time, for instance, so that we can understand that there's more ammonia emissions from agriculture in spring and summer than there is in winter. But sadly, this one is mothballed and hasn't really been taken forward. In things that are misunderstood, we all think about transport sources a great deal, and we view air pollution really through, a lot of people do, through a transport lens. Things that we struggle to understand a lot, I think, would be wood burning, if I could put that in there, cooking, which is in the London inventory but not in the national one, and then the issues of non-exhaust emissions from road traffic, which when it comes to PM is actually greater now than what we get from the exhaust pipe. of cars.
Yeah, thank you very much. And we were speaking about the many things that we don't know and the need for improving our data. But I noticed in your written evidence that there are a number of global international studies that have looked at air quality and air pollution in great detail. I mean, do you think that broadly we do have an understanding about the extent to which air pollution poses a real threat to health, and whilst we could do with knowing more locally, that the fundamentals are broadly understood now?
Yeah, I mean, I'm not a health expert. I've worked on many epidemiological papers, and I think there's the case is made, and the case has been made for a very long time, that air pollution is harming our health. It's shortening our lives. It's adding to the burden of chronic diseases that are being, that we see all around us and are posing great costs on the NHS, wider society, and our economy. I think it seems to be the difficulty is in the translation of this evidence into action, and that's where we need to do more.
Yeah, I mean, Ms. Laxton, is there anything you'd like to add in terms of misunderstood pollution sources particularly?
Not so much misunderstood, but the issues we might encounter going forwards as other policy drivers change for net zero and the like. So there are other pollutants. If we're moving towards ammonia as a fuel, for example, and ammonia slip from shipping, which might be used. So these are ones that we know could be an issue, but we aren't necessarily focusing on. There's also such a wide range of pollutants. When you dig down into the detail, I know Gary talking that it's accepted that there's air pollution issues and air pollution risks and health impacts, but what we aren't necessarily there yet is with the detail of what subsection of particulate matter is causing the most issue and what details do we need to do. And there's overarching desire to reduce emissions is the key message, but there might be targeted areas we need to focus on as well.
Yeah, I mean, on that, do you, Dr. Fuller, think that the government's current approach to improving air quality, which focuses on limit values, is adequate? And should there be a restructure on what government monitor and target?
The whole structure around limit values stems from a time in the 1990s when we thought that there was, let's say, a safe or zero effects threshold for air pollution. And that's the science of the 20th century. In the 21st century, we've learned that that isn't the case. And we're in a position whereby this focus on limit values is leading to maybe even perverse outcomes. It's causing local authorities, let's say, to focus on the busy road junction that they may have in the centre of their town, rather than the areas where, in suburban areas, where there's mainly elderly people or young people that may be exposed to pollutants from, let's say wood burning or traffic there. So it's giving us the wrong priorities. But we also have to think about transparency and accountability, and limit values are very clear to people and they do drive action. So the alternative would be to think about perhaps tightening them. The people who live, I live on the south coast, just 60 odd miles away from me across the channel. People have far greater protections for air pollution than we're enjoying in the UK. And also, if I could put on one more thing on limit values, I don't know if you've seen the work in Canada where they have a couple of other sort of different mantras in here. So it's not just the attainment of a limit value, but it's one of continuous improvement. It's part of their policy philosophy, and also keeping clean areas clean. So I think there's a lot we could do in terms of shaping it to have things that are complementary to limit values.
Yeah. Mr. Laxton, you want to come in on that?
Yeah, I just wanted to echo what Gary said, but also say that I think one of the issues is the communication of what limit values are. And so with limit values, at the moment on DEFRA's website, they say the limit values are there to protect health, including vulnerable groups. And that definition is, as we all accept and know, isn't based on the health evidence at all. So it's that communication of what they're representing is misinformative and doesn't help the wider agenda of trying to protect health.
Yeah.
May I add one more point?
Yeah.
I think we were at quite a perilous position here in terms of UK air quality management and our capability to act. From the 1970s, we thought we had it all worked out from, the smog of the 50s was over, and we dismantled a lot of our capacity to be able to act. And we're in a similar position today. We're attaining limit values. Local authorities are revoking their air quality management areas and to some extent removing their measurement programs. And having these things in place and having certain things that are triggered within planning that are close to limit values means that there's a whole ecosystem of agencies that are working together. Once we begin to dismantle this by revoking air quality management areas and just slipping 1/2 of a microgram below a limit value, we run the risk of losing a lot of capacity to act.
And Dr. Tom, did you want to come in on that point?
Yes. I mean, in terms of planning, the National Planning Policy Framework explicitly talks about compliance with the air quality standards, the limit values and the objectives. And my experience of working in the planning system is that you get cross-examined by a barrister about it, and they will always point to that paragraph, even though throughout the NPPF there are references to protecting health. But that one paragraph that explicitly talks about compliance dominates the whole air quality debate in the planning system. And while that remains in there, air quality probably will never be taken seriously, especially now when the limit values and the objectives are just met so widely now. We have relatively few exceedances compared to how we have. I mean, Gary was just talking about the number of air quality management areas that have been revoked. In my daily work, we work with local authorities, and so many of them are thinking about revoking, going through the process now. So we might have reduced them from half from the maximum number there were, but that's going to carry on. And as Gary was saying, as a consequence of that, we are gradually losing expertise within local authorities. And one of the problems has been that because many local authorities don't regard air quality as a problem anymore, they now in the 1990s, every local authority, more or less, across the country had an air quality officer. Now you have combined officers. So you might have a contaminated land officer who also has the air quality portfolio. They're both extremely technical areas, and one person really can't get to the depths of both those issues.
We're going to be exploring the whole issue of local government in the second panel, but thank you very much for that. Sarah Gibson.
Could I just have one supplement?
Sorry, please,
Could I just ask, you see, if you move away from limit values and move to a wider definition, for example, you've mentioned health, would you not finish up then you could have different requirements for different areas? I mean, for example, where there's a lot of elderly people living, a lot of children there, maybe there's a school, and then later on the school disappears because it's moved to somewhere else. So do you not then get less clarity on what the limits should be, or what the measurements should be, and how do local authorities cope with that kind of situation?
Shall I?
Well, I would just say that we are, in a way, already moving in that direction, because some local authority have their own targets, particularly for nitrogen dioxide, that are lower than the 40 micrograms a cubic metre. So we're already going into that arena of having different standards. I personally think that there needs to be a national standard that is much more representative of the health impacts. I mean, for nitrogen dioxide, we're talking, the 40 micrograms per cubic metre is based on health evidence from the 1990s. We know over the last 30 years there's been a huge amount of research into it. We know that WHO, with their air quality guidelines published in 2021, has an annual mean of 10 micrograms per cubic metre. That's a quarter of what our standard is. And I believe that we do need to have a new standard, whether it's a limit value or an objective, and that's another issue that we have that complicates the whole issue, and that we have a dual system, two different systems of air quality management in the UK, one originating from air quality legislation in 1995, the other one coming from European legislation, and that confuses everything. So we have objectives that are target values for local authorities, and then we have the limit values which are mandatory, and since we left the EU that's all become more merged and confusing, and sometimes even some of the documents that DEFRA produce seem to not quite understand the difference and the origins of these two parallel systems. But I do think we need, whether we call it a standard, an objective or a limit value, I believe we need to have an appropriately set level for it. And we don't have that at the moment.
Okay, if we can carry on, I think we will be asking questions that will come to many of these issues. So, Sarah Gibson.
So, sort of sticking with what Dr. Holman's just been talking about in terms of the concern over focusing on limit values and different measuring tools. I was going to start with Dr. Fuller, but how should the UK's monitoring networks evolve to fully capture the sort of totality of England's air pollution? I mean, you talked about it being less from exhaust pipes and more from other elements of vehicles, to include the sort of emerging pollutants such as the ultrafine particles.
Yeah, I think it's a really good question. I think it's one that we should be asking at this time as well. I think we need to be moving beyond compliance measurement. So most of the measurement networks that we have are designed to tell us whether we meet something, just yes or no, but not why. Yeah. Or, what's the underlying causes behind this. And there is different models of being able to do this. If you move to, let's say, a next generation of air pollution measurement sites, we've got some examples in the UK of these so-called super sites, whereby you measure multiple pollutants, and when it comes to particle pollution, we're looking at things like the chemical composition. That way we can see what sources are affecting an area, how they're changing, and how they're changing in response to policy, and also we can collect data that's useful for future health studies. So that would be my first one, would be to be an evolution of this towards measurements that explain what's going on rather than just tick yes or no. And we've got some examples of these already in the UK, and I can talk more about them if you wish. The other one, we also have sensor networks that are becoming well established, and I was quite cynical about these, to be honest, when they first appeared, about the accuracy of instrumentation. But having worked with communities that are using them, the main thing it does is it gives them voice. It means that they can say, with some degree of objectivity, air pollution in my area is bad, and they can then take this to be at the Environment Agency, their local council. So it gives them voice and agency. And the last one I would say is we need to be involving into the indoor arena. Most of our air pollution exposure occurs indoors, but we have no systematic way in the UK of assessing exposure in these places. And Kieran's point of looking forward over the next couple of decades, we're going to be making huge changes in the way in which we heat our buildings, huge changes in the way in which we insulate and ventilate them, and we have no systematic programme that can say where we're at now and where, what's changing.
Sorry, Kieran.
I just wanted to say that where I see an area which Gary hasn't covered is actually personal exposure monitoring, and actually having a campaign of how individuals journey through life, through their day, and how they actually truly get exposed, and having a system which actually can represent different groups of people and how, whether they commute into the office and where their exposure is, because most of this is dealing with static locations and concentrations in locations, but actually that true exposure is such an important thing to be able to understand in order to be able to then change behaviour to improve how people travel around and reduce and manage their exposure as well. So without that monitoring programme, there can be academic studies, but if there can be a more complete picture, there will be a lot more information that will be able to be fed back and help inform decisions.
Well, that's quite interesting, because what I was going to ask is what sort of improvements in measurement would most benefit research so that we can have policy developments? Because I think from what you're saying is that if we're only monitoring the places and not the people, we don't know, and we already heard from previous visitors that there are people whose long-term life cycle approach has actually been detrimental to them. So I don't know, Dr. Holmes, if you wanted to.
Sorry, what was the question?
So what improvements in measurement would most benefit the research, do you think?
think exposure is a really interesting one, because if you think about the way that we look at air quality management and air pollution management, we start with, looking at the sources, the emission inventory. We then do some modelling, we do some monitoring, but actually it's the last bit of that sort of chain that's important, which is the exposure, and that's the area that we know least about. I mean, some of Gary's colleagues did a really interesting piece of work many years ago. I think it was sponsored by Dyson. They had these kids with their backpacks and they were measuring it. The assumption was that because they often travelled along a busy road to go to school, that would be the main source of exposure, but the main source of exposure was actually in their homes. And this whole thing about indoor air quality is something we spend, 80-90% of our time indoors, and it is very much a black box still. I mean, there are studies going on. I mean, Gary's colleagues are doing some great work on it, but we're still at quite an early stage of really getting to grips with the indoor environment, and it's very difficult policy-wise, because government doesn't like, or doesn't feel like the public want people to interfere with their personal space. We do have building regulations. The building regulations are weak in terms of air quality within new build buildings, and that might be an area that you might look at. The Part F on ventilation.
I think that's an interesting point. We've been quite happy to have smoke alarms in our houses, and most businesses have carbon monoxide monitors. But in my office, we had a carbon dioxide monitor, which was really interesting, because by the afternoon we were well over the limit, which explained why we were all exhausted and tired.
Sleepy.
So I think there is a lot to be said for that. So thank you very much.
Thank you very much. Carla Denyer.
Thank you, Chair. Really interesting answers so far. Thank you. And yes, I agree with the points made on indoor air quality. It's not part of this inquiry, unfortunately, but personally I hope that we can look into it separately soon. So I've got a little set of questions which are basically all about measurement versus, and I know it's not as straightforward as versus, but measurement versus modelling. Firstly, can I just ask, Mr. Laxton, you were talking about and Dr. Holman, you were talking about exposure measurement. So do you mean literally people walking around with a little sensor on them, like people at work with radiation have to at work?
That is one route to do it, yes. And as Dr. Holman did explain there, that there are academic studies following around people, but there's also models that have been developed to consider exposure during different people's phases of their journey in a day, whether they're in travel, at home. I think one example is the Dimex model, which came out of Manchester University, which actually looked at where you get exposed. And actually that was an interesting one, because it didn't necessarily always correlate between where the highest pollution was and the greatest exposure through a day, because of where you travel. So yeah, in response to that, what I described there was individual exposure monitoring to understand that, but there are other exposure journeys and through modelling as well.
Great. Well, you've led me perfectly into my next question, which is about that. So I fortunately have a background that helps me to understand this, because when I worked in renewable energy, I was working with both wind measurements and models, and so I know from first-hand experience that sometimes models can be surprisingly better than direct on-site measurements at predicting long-term wind resource at a potential wind farm site, for example. So, totally understand that sometimes modelling is the better way forward. Also understand that there's several different models out there. So starting with you, Mr. Laxton, can you tell us what are the advantages and disadvantages of the current UK models, and are there particular areas where they are not capturing things and where we need to see improvements in modelling?
Do you ask this question in the context of national modelling or local scale modelling?
National, yeah.
So I mean, we're in slight flux and change at the moment, because historically limit value modelling, compliance modelling has been carried out by one organisation, and that's changing as we speak right now. So the modelling approach is changing as part of that. The historic version was developed over many years, but it based on some effectively spreadsheets which built up an understanding of how dispersion occurs from roadside pollution. that is now, there's a step change that's about to happen to move towards chemical transport models, which will actually model much more of the evolution of pollution and at a better spatial scale from what I understand, although it's in process right now. So there's a change that's about to happen. But you almost need to go back and understand that with national scale modelling, they're not well designed to look at the fine detail at, for example, around a road junction, and hence why compliance reporting with limit values specifically avoids looking and reporting within a certain distance of a junction. Even though we know that's potentially where the highest pollution might be, those national scale models are excluding those areas. When you go down to smaller scale models, you can actually start to look at those, but there's a sort of currently a disconnect between those two models and different domain sizes. I will say there's advances in looking at using machine learning to link those two together really well. I know NVIDIA's developing a project to look at that downscaling from large national modelling down to very local one by training up data sets. So there are opportunities there in the future, but at the moment we have different models for different purposes, and I think we actually have pretty advanced modelling capabilities in England to do stuff. We have a good understanding of it, but like any model, there are assumptions, there are simplifications, and there's therefore a limit on how many scenarios you can test, and you have to have a clear purpose for what you're trying to achieve out of modelling itself and what you're trying to test.
Okay, I'm going to drill down on that, but first I just want to see if Dr. Holman and Dr. Fuller agree with that analysis of where the weaknesses are, if there's anything else you want to add on that.
Not really, no.
I think models are brilliant, and they've come forward hugely in the last 30 odd years since I've been doing this, and national modelling was done on spreadsheets. We now, they're deterministic, we understand a lot of the mechanisms. Still, we are going to need a lot of good measurements and the right type of measurements, going to your question earlier, in order to be able to feed into them. It's this known unknowns, and and Rumsfeld's known unknowns, but the example I would give would be Dieselgate. If you sat in the measurement room at our place when we were at King's, around that time, all of the graphs on the wall were going upwards. If you went next door into the emissions inventory in the modelling room, all of their graphs were going downwards.
Yeah.
And so we have to make sure that, we use models to the huge advantages and the capability they're doing, but we must be making sure our measurement systems are designed to be able to not just validate them, be able to feed into them.
Okay, yeah, great, thank you. And are there, zooming out from outside the UK, are there lessons that we can learn from elsewhere? Are there best practice examples in terms of modelling that other countries are doing better than us?
That's an interesting question.
It's usually worth us asking, because often the answer is yes.
I think things are done differently in different countries. In the US, they're much more having a mandatory model. The US EPA develops their own models, and it's actually put into the Federal Register which models can be used, and so it's a very much top-down approach. In the UK, we have a very laissez-faire approach. You can use any model you like, so long as you can show that it works, sort of attitude. In Germany, they have a more closer to the US approach. They have a much more, this is the model and you've got to use it. And the problem with that sort of top-down approach is that it's inflexible. And models are evolving all the time, and new things come on stream. So I think having a more laissez-faire attitude is probably the right approach. But this is looking at like local modelling rather than at the national. The national scale obviously is done depending on who DEFRA's contractor is. But I think at the local level, I prefer that we should be able to use the models that we think are suitable for any particular purpose that we were trying to apply it to.
Thank you.
I would actually just want to add that there is one of the problems is that in the mountainous alpine countries, they obviously have special models to take into account the topography.
Yeah.
There are circumstances in the UK where we might want to use those models and we don't. And then we get completely the wrong answers in our models because we assume it's much flatter. And it's really, particularly when you get values, you get radiation inversion, so you don't get the mixing of the air, so you get much more concentrated concentration at ground level. And there's been a few cases where that has been a problem.
Okay, so you're saying that if anything, it should be more laissez-faire here so that we can use models developed in other countries where they're applicable to the geography. Mum, would you agree?
So I would. I know Claire has added the caveat I was going to say that there are situations with complex terrain and challenges. And so a modelling suite that we don't use very much here in the UK for air quality specific is computational fluid dynamics at a very small scale. It's used for thermal wind comfort studies in street canyons and how wind moves around. We very rarely look at using those when planning designs of urban cities. I mean, it's definitely done. I'm not saying it's not, and it's more in academic worlds it's done. But for development, planning type scenarios, we don't ever really use it, even though it is clearly the best tool for looking at how pollution and air moves around those complex areas. So there are, and if you go to Australia or to the US, it is used more for those type design scenarios.
Okay, thank you. And finally from me, I want to ask about uncertainty. So in my experience, sort of outside of people in the engineering and science profession, quantifying uncertainty is not terribly well understood, including in local government. So how is uncertainty currently quantified in the modelling, and do you feel that is sufficiently clearly communicated to the people that are using the results of that, whether that's planners, local authority employees, or indeed politicians?
I would just say you give a planner a number and that's the number.
Yeah, that's also my experience.
But Kieran is more of a modeller than I am, so I think he probably should answer it. I mean, there is guidelines in the local air quality management technical guidance about the sort of statistics you should use. But Kieran.
Thank you, Claire. There is obviously, we've already established, there is uncertainty in modelling. There's uncertainty in monitoring as well. And as Gary said earlier, that the best modelling studies are grounded in the truth of the monitoring. So you understand that. And there is good practice in doing a model performance study based on monitoring. That is accepted practice. Obviously, that allows us to understand the now, not the future. And there are, as Claire mentioned, there's technical guidance for local authority air quality management on what is acceptable model performance from considering road transport, road emissions. There's less standards and performance evaluation for other types of emission sources. So if you've got a plume that's coming out of a stack, there's the uncertainty in that is dealt with by doing sensitivity tests, so scenario testing of different meteorological years, or assuming that there is terrain or there isn't terrain. So, but there's only a finite number of practical number of runs you can do within the model. And the issue is actually all the communication, understanding which is right. Is it worth adding error bars on? Potentially not. If you're trying, depends on the message you're trying to get across. And this is almost where I think Claire said at the start that the expertise is being lost by decision makers or people informing decision makers to be able to understand what modelling results really are showing. And without that, the ability to scrutinise modelling and understand what it's truly saying, like it sounds like you're very familiar with that yourself, it's not possible to trust the exact number, but it's also not possible to question the number. So you have to trust it almost blindly. So by losing expertise that is sort of happening, that's the high risk, and that then links back to the fact that, going over old ground, but the fact that air quality of roadside NO2 is sort of almost treated to be solved, and so therefore air quality management areas are disappearing. There was a stage when local authorities would do detailed assessments, modelling assessments for hotspot areas. They would then have a really good understanding of the requirements. There's set out modelling guidance in the technical guidance for local air quality management. That skill set is largely lost from local authorities now, and that's the risk. So we can give a number, but without the skill set to be able to actually interpret the number, it's kind of a really challenging thing to do. So it is possible to provide all the information, provide the uncertainty, but it's meaningless, even the uncertainty range, unless someone understands what those extremes mean, what's unrealistic and what's realistic. You can run a model to show you anything you want. That's the problem.
Okay, so in summary, the loss of air quality experts in local authorities is
informing decision
big part
makers,
of the problem
yes.
in terms of informing decision makers about the uncertainty, and not just saying, oh well, that number is 0.01 below the limit, so we're fine.
Exactly.
With an error bar of 0.5 or something.
And that's where there's, I'm sure we'll come on to it in a bit, but the planning reform, I think there's possibly discussion in the later sessions, but there is a potential risk with the reforms to MPPF of losing that requirement to consult the existing expertise within local authorities, so EHOs, so they're being removed from the decision making. So those authorities that have that retained knowledge, they're going to get isolated and removed. So there's a real risk of disconnecting those even further as well.
Not listening to experts.
Thank you very much. Chris Hinchliffe.
And thank you, Chair. And following on from that, my questions are relating to the planning system and whether it's fit for purpose in terms of improving air quality. I was going to start with yourself, Dr. Holman. When we had Professor Sir Stephen Holgate in front of us in a previous session, I asked whether from the majority of development in this country is being planned sustainably from the perspective of health and air quality. And he replied variously that it is a ragtag and a mess, it is shameful, it is a shambles and not working. And I wanted to know whether you agreed with that assessment, and in particular whether you thought that cumulative impacts are being properly considered.
Okay, that's quite a big question, but I think I've probably already answered it to a certain extent, because we just have this 40 micrograms per cubic metre, annual mean, NO2, we're meeting it, tick the box, fine, don't care. And actually what the planning system is about determining, this is my piece of land I want to develop. Is what I'm proposing for this piece of land a suitable use for it? And so what we should be doing is looking at much more within the planning system about what's the air quality here and what is it being used for. Is it being used for a school or a child's nursery or a care home or a hospital, all of which are members of the population who are more sensitive to the effects of air pollution. The way we deal with it at the moment is we assume that everybody's the same. And I think there should be greater granularity in terms of how we deal with planning depending on the use of the land. So one of the assumptions is that often if it's an industrial activity, that those people will be healthier people. They're in the workplace and they're less sensitive. But if you've got a children's nursery, you might be very careful about where you put that, because their lungs are developing and you don't want them to be exposed to things. So does that answer your question?
That's a good starting point, yes.
So the next thing I think was about cumulative impact.
Sorry, Claire, before we go on to that, is it okay to add something before we get into cumulative? Because Claire almost touched on it there, that we need to consider that the planning balance is about balancing trade-offs. We have to allow development, that's the right thing to do. And so if you're going to do a balancing of scales, you have to consider the air quality health effect. Obviously, there's ecological effects as well, but in terms of health. And so to truly do that, comparing it to a limit value or an air quality objective is the wrong assessment scenario. It's the health effects. So you need to present a scheme needs to be compliant with the objectives or the limit values. It needs to make sure that it's not inhibiting the ability to achieve those. But that's one part of the assessment. The actual health bit, the air quality health assessment, is looking at the people using it, how people will access the site, how they're going to get there. Do they have to walk, if it's a school, do they have to walk along a really busy road in order to get there, or can they walk along exposure routes which are not related to that? And actually truly thinking about design, and that is not considered really at all in the planning system, because the simple test is it above or below a certain number? And when it's below that, it's very hard for local authorities to push back and ask for developers to do better, even though we know they can do better, to do better. And so we need to separate, and IEQM as I said before, professional body, they are developing, they have guidance. Their guidance has historically been used quite effectively within the planning system. It's being rewritten now to truly try and address this issue, to talk about there is compliance, but actually the health effects are important and understanding those. And I'm not saying that the WHO guideline levels are the right levels. I'm saying that we have to base it on health evidence and do them as two separate considerations. We're not obscuring the ability to comply with the objectives or limit values, that scheme, but actually at the same time, has it been designed in the best possible way to reduce the emissions? Has it been designed to reduce the exposure? Has it been designed to make sure that when people are trying to get to that site or leave the site to go to work and their journey through the day, has that been optimised? And currently the planning system doesn't consider that in any way, shape or form, and that I think will deliver the greatest benefit to the planning system if it starts to consider those good design and the ability to decide whether the design is good for air quality.
Thank you, Mr. Langston. I'm going to come back briefly on cumulative impacts, but I've got a couple of further questions, so probably keep that brief if we can. Or if you wanted to comment on the
impacts. So we do consider cumulative impacts when we do an air quality assessment, but we're very much in the hands of the transport consultants. And what the transport consultants do is they look to the future, knowing that traffic is going to grow. So they look at the future baseline with the development, which actually includes traffic growth, and then they put the impact of the development on top of that. So in terms of air quality, we just take those traffic numbers that are given to us, and so we're not really looking at cumulative impacts of the different developments. We're just looking at what's going to be projected to happen in the future, plus a bit more from the development we're looking at. That's in very simple terms. If it's an environmental impact assessment, the local authority might say, well, here's a list of developments, and the transport guys might explicitly consider them. But in my opinion, we don't deal with it well.
Okay, thank you. Mr. Langston, I'm just going to come back to you on a sort of related point to what you said before about balance, because obviously over the last 20 years or more, we've had more and more deregulation of our planning system with an aim to permit more and more development. But given what we know about air quality, its really severe health impacts, the fact that it relates very closely to deep structural inequality in our society, would you say that we need to have within our planning system a firmer red line where it no longer becomes, beyond that point, it's no longer a question of balance, and we say the risk of harm is too high to permit under those circumstances?
Most of the thresholds we talk about are about long-term exposure. So, and what I think is, if there's any scenario where there's an acute short-term exposure that is going to cause harm, then that should be a hard red line. I think that it is really hard to give a firm answer because there's clear health impacts, but there's also the health benefits to certain schemes as well, and it's that trade-off that's important, and it's normally considered at the first stage of looking at development, and actually the second stage is then what can the development do to mitigate the exposure and reduce stuff. So I think there is a hard line in terms of we don't want to expose people unnecessarily where there is better design. So that's, for me, the key thing is, if you can do better and you're not, that's the issue. Not that because at a national level we should be driving emissions down. If every scheme is minimising their emissions, minimising their exposure, then we are delivering overall. And it's that design that's the key thing. I do have a point on cumulative, but I'll let Gary jump in.
Could I just crystallise that point? You know, you must have come across, I presume you've come across the sort of Vision Zero that we hear a lot in road transport. You know, we should not be building road junctions where we will have 10 or 12 people dying over a 5-year period or something like that. We should be looking for every opportunity to get towards zero. And I think that philosophy, bringing that into air pollution, more or less in the way you're saying, could be a good framing for a way forward.
Okay, thank you very much. Very briefly, and then I've got one final question, but very briefly on the cumulative.
Well, the cumulative, only that there's a positive that at the moment in Northern Ireland they've just very recently rolled out APAS, Air Pollution Assessment Service, which is an online government service in Northern Ireland. the point I want to make there is that is becoming a register of permitted and planning applications that have gone in. Through having that centralised register, you can start to take account of cumulative development. It's the first time there's going to be a centralised one for Northern Ireland, and if there was an equivalent one for England, a centralised register of all these planning applications, permit applications, easily accessible, you can start to account for it. Now, the flip side of that is you never know what is truly built versus what's been put in for planning and how it evolves after the point that is submitted.
A possible recommendation for this committee to consider for England.
A centralised register, yes.
So, Dr. Holman, my final question's back to you. You mentioned about the NPPF, National Planning Policy Framework, and the paragraph that refers to compliance with limit values, and we've already discussed that. My final question is how you would recommend amending that. I mean, what is the detailed change that you think needs to be made to the NPPF to get us to a better place on air pollution?
What, you're going to ask me what the paragraph number was?
I might do.
I think it's important that compliance with any limit values we might have in the future is still in there, but it's this thing about explicitly considering exposure and the health impacts. So it needs to be a dual thing: compliance tick, exposure tick.
Thank you very much. Thank you, Chair.
Is there a danger, as we move on, that we sort of look at new planning applications and consider the exposure someone living there is going to have, but not really consider, well, where are they now? You know, the houses haven't created the people are already here. These people might be living in urban environments, very over-intensive. Actually, yes, there might be an air quality conclusion wherever they move to, but it might be a hell of a lot better than where they were before. So are we actually weighing up what we're creating in comparison to how these people are living now, or are we just thinking, well, this new place we moved to might be imperfect, so let's stop it?
You don't know who's going to live in a new development, so you can't actually do that. And what you want to do is to make things better in the future, because housing stock is there for, I don't know, 80, 100 years or however long. And I think you've got to make sure that that's going to be good, because we know that there is no threshold below which there is no health effect for these individuals.
But by the same token, we're saying that there is very much a deprivation index here. The more deprived you are, the more urban you are, the more intensive and packed together you are in a property, the greater your exposure. And then we're just saying, well, we can't really measure that, so let's just try and make sure we build it better in future. I'm obviously not against building it better in future, of course I'm not. But I'm just saying that is the other part of this whole equation, is we might be stopping these houses being built because it's less than perfect, and actually leaving people in much worse environments as a result of those houses not being built.
I think there's some obvious easy wins. I mean, we talk about log burners being in houses, and we're permitting them to be installed in existing properties as well. And yes, they might be certified, but that we know that they are a direct source of pollution in households. Existing stock, nothing to do with the planning system, and yet we're still permitting them to occur. So there's definitely things that can be done to improve existing house stock as well. Yeah. So those, I take your point that people might be moving from old housing stock in areas of potential high pollution to new houses, and so therefore, and that might be a stepped improvement, but we need to focus on improving those existing household stock as well. And gas combustion in residential properties, that needs to go. In fact, any combustion, whether it's from log burners or from cooking or central heating, obviously accepting there are massive challenges. I sort of wanted to come back to the planning thing, and there's two things that haven't been mentioned so far that I think are important. And at strategic, we're talking very much about development control, the specifics of individual developments, but actually strategic planning is not considering air quality in any way, shape or form, that's unfair, nowhere near as much as it should. So when we're allocating land at strategic planning level for certain development types or certain land use, air quality is not considered in any specific detail. So we can have an allocation of a land for residential, for mixed use, for commercial, but then it doesn't say, well, actually, is this the best location for that in regards to air quality? Those studies are sometimes done, and we have done them for local authorities, but they're very rarely actually done. And the importance then is when it does look into the detail, inequalities is missed out in the planning system. This was about, so let's say we have an allocated patch of land for residential. We don't then say, well, actually, are those more vulnerable, exposed to the locations nearest to the road? Is there a disparity between people's susceptibility to poor air quality and where they are physically put on the site? That is not tested in the planning system at all at the moment. So the inequalities exposure is not tested, and that's something I think should feature in an MPPF test. How is inequality being considered in the health context?
Thank you very much. Ross Savage.
Thank you, Chair. I'm going to direct my question to Dr. Holman first, but I would like to invite the other two panellists to weigh in on this afterwards, if you would like to. At the moment, there's a bit of a mismatch between responsibility and the power to actually do anything about it, in that local authorities have got the responsibility for measuring air quality and for coming up with action plans if there are exceedances that need to be reduced, mitigated, whatever. But a lot of the factors that are contributing to the air pollution are outside of the control of the local authority. So national transport policy, planning rules, vehicle standards, infrastructure, things like that. So looking at that legal responsibility for air quality exceedances, is there a fairer way that that responsibility could be allocated between developers, between local authorities and between central government, in your view?
So when they set up local air quality management, they had objectives which were policy targets in recognition of just what you've said, that so much of what affects air quality is determined at the national and to a certain extent the international level. We now have limit values. Now when we were part of the EU, the competent authority was DEFRA for the whole of the United Kingdom, and they had to report to the European Commission on an annual basis. We're now not in there. Now I'm a bit confused as exactly what position we're in. So I know that DEFRA did devolve to London responsibility for air quality achieving the limit values. Now, I know that where the limit values have been exceeded now, the local authorities are responsible for coming up with the action plan and whether or not they adopted a clean air zone. But I don't know exactly where the actual responsibility lies anymore, and it might be something that you guys will be able to find out. It's just that confusion because the legislation has remained within our statute books. Because we introduced it through the air quality standards regulations, I don't know, 2010 I think they were. So that doesn't actually answer your question. So your question is, where should the responsibility be? And I think the central government needs to take more responsibility than it is at the moment. Now, having said that, when I was the technical expert for Client Earth when they sued the government over the air quality plans in 2015 and 2017, so at that time they didn't take it very seriously, and then they were forced to. And so those clean air, I think it's 7 local authorities outside London in England have clean air zones, and they were basically forced to because of the Client Earth action, and they were funded to do so by central government. So central government have funded all those studies that have been done. I personally think an awful lot of money has been wasted on it. I think the whole process has been incredibly bureaucratic. The fact that those 7 clean air zones, this is probably not where you were going, but I'm going somewhere different, I'm sorry.
It's very interesting, please keep going.
Where the clean air zones, those in the 7 local authorities, were not started until between 2021 and 2023. I would remind you that the limit values were meant to be achieved in 2010, and this goes back, first of all, to a 2008 directive, but also the same limit value was in a 1999 directive. So it shows a long history of government of any persuasion, of both persuasions, who have not taken air pollution seriously over decades. And I think what has happened in more recent years, is push it down to the local authorities. We don't want this problem. And I don't think that's solved. I don't think it's solved anything. I think, as I said, wasted a lot of public money, which I, as a taxpayer, don't like to see. And has it really achieved that much? It's achieved a bit, but not maybe value for money. I don't know.
Very revealing
Kieran
answer.
wants to
Thank
say
you.
something.
Mr. Laxon.
I'm going to try and answer your actual question.
Apologies.
We're talking about limit values as if there's only one limit value, and it's pollutant specific. That's the bit that we've missed in this conversation. So if we're talking about roadside NO2 concentrations, then that is a very local problem. The emission source is road transport that's dominating that, and local measurements and local authorities have a true understanding of what's going on. But I think from national modelling, it's very hard to pick up that detail. And actually my experience of doing modelling for clean air zones and work on that is actually the detail of how the road's set up and what's going on, and actually having those conversations at local authority level, which can have the biggest improvements. So there has to be responsibility at local authority level to help solve the problems when they're very localised emission sources. Delivering overall, I think, is a central government, and because that delivering can come through emission standards, other policy drivers which we've talked about, but the local knowledge is an essential part of what's going on. If we're talking about a different pollutant like PM2.5, which we haven't really talked about, then actually at the moment the monitoring for the annual mean concentration target for 2040, that's only breached in one location in the UK, measurement location, which is in London, and that is because there is a much harder to deliver that, because that pollutant is not exclusively local pollution, and it's driven by regional pollution as well, and there's a lot more to consider. So that has got to be taken from a more national perspective. And then my point is, it's pollutant dependent on whether you engage with the local authorities who have that local knowledge and get their feedback and buy-in to help support things, or whether it can be best delivered at a national level.
Thank you.
Could I say a word in defence of the low emission zones that have been rolled out over the UK from Claire's point? That one in London, okay, it's through a different process, but it's been astonishingly effective in reducing NO2 concentrations. Even before we reached lockdown, NO2 in central London have reduced by nearly 40%. But we've got health studies from the Bradford one, which is the second largest outside the UK, and they've found reductions in GP visits for both cardiovascular and respiratory problems by somewhere of the order of about 25%. And, that's an astonishing result for hard-working GPs and the workload on them, but for the individuals involved as well, and how much it's, lessened the harms and improve their everyday lives. So I wouldn't like to write off the low emission zones.
I wouldn't either, Gary.
Oh, okay.
I'm not anti-low
So
emission zones.
there should be a debate between us.
It's just that they were introduced, they took so long to be introduced. They would have been a lot more effective if they'd been introduced earlier. And I was just trying to illustrate that the government has taken an awfully long time, the governments have taken an awful long time to actually do anything.
Thank you. I see Mr. Laxon wants to come in again.
Yeah, we do need to move on shortly.
Okay.
I think, can it wait, or is it...
It's a slightly different point, so I'll wait and see what other questions come up.
Okay, all right, well, now we come to Sojan Joseph. Thank you.
Thank you, Chair. I think my question is just following on from the previous question. You already touched on some of. We have received several submissions of written evidences from various local authorities, and almost all of them stating that they felt the local authorities do not have the resources or power, which include money or a clear direction from the central government to control this air pollution. So my question is, where are the biggest gap or inconsistencies in current air quality assessment guidance, and how can this be improved?
That's you two. You work with the guidance much more than me.
If we can ask Dr. Holman.
Guidance is old. The guidance was originally written. When was the first guidance document written? 2003? 97? 1997 was the first one, and fundamentally it hasn't really changed. It's been tweaked, and I think it needs to start again.
Okay, I will chip in with. I'll chip in with one. What would it look like if we move this away from compliance and a tick box of do we achieve 40 micrograms per cubic metre and hand this over to public health people to say how could we, going back to I think your point, the investment we make in improving air pollution, how can we get maximum gain from that? Well, that might bring us to a focus on, let's say, vulnerable communities. We might want to invest a lot more around schools, for instance, but we don't have that in our policy sort of portfolio at the moment. I'll set up Suzanne, who I know is behind me. Suzanne is a public health person, and maybe later on when you see her, she might be able to say something about how viewing air quality management through a public health lens could be different. You know, how do we actually achieve greatest impact rather than just how do we tick a box of 40 micrograms?
I was going to just try and think about the local air quality management and local authorities' perspective. So at the moment there's a real risk of we're losing low emission zones, clean air zones. We're also losing air quality management areas. They are different, the air quality management areas, to that. And as we lose air quality management areas because of being compliant with the 40 microgram threshold, we're then losing air quality action plans. So local authorities have to develop these action plans. They don't have to have those once an air quality management area is gone, and they are being revoked, as Gary said, at least 50% of them have already gone. And then the requirement then is to develop an air quality strategy. But there's no guidance on what should be included in that air quality strategy. There's no, from central government, there's no steer on how that, or DEFRA, on what should be focused on. There is very specific prescribed requirements for developing an air quality action plan. It has to deliver meaningful results, but there's nothing for air quality strategies. There's also a scenario where local authorities generate annual status reports, reporting their monitoring. Now, they're meant to get those submitted by a certain day, month of the year. DEFRA are meant to respond by a certain month. We're still waiting on many of those that are overdue from DEFRA to review those and come back. And as soon as you get from central government, the reviewing of those documents taking such a long time and not being done by their own timescales, then everyone starts to lose interest in the purpose of them. Are they delivering anything? So you've got no one's marking their homework on time, effectively, and then you lose the story, you lose the information, the communication from those annual status reports, reporting about the monitoring, because they're meant to be timely about, so you can then use that data throughout the rest of the year to help with communicating air quality stories. That doesn't happen because you don't get it till near the end of the year. So there's a role to play for central government to give information back and respond to these things for local authorities quickly. And there's a role for local authorities to be able to do more once they are removing their air quality action plans. But it would be helpful to be steered by central governments or DEFRA on what the content of the air quality strategy should have, because we are losing that really specific requirement, targeted focus is going, and it's becoming these air quality strategies are now just let's do some improvements and minimise emissions where we can, and they're sort of much more high level, which is not necessarily a bad thing, but there's some targeted guidance would be super useful for from DEFRA.
Could I just slip in with a quick fact? Out of 910 air quality management areas that have been declared, according to what I looked up 2 days ago, 449 have since been revoked. But none of those locations will be meeting WHO guidelines for air pollution, and I would think very few of them will be meeting the EU ones.
Okay, thank you. Well, Dr. Holman, Dr. Fuller and Mr. Lexon, thank you very much indeed for what's been an excellent and informative session. We'll bring this first panel to a close. This sitting is suspended. Order. Well, welcome everybody to the second of our two panel events today on the subject of air pollution in England. We now have our second panel in front of us. I'd like to invite all of you, starting with yourself, Dr. Bartington, to introduce yourselves, the organisation that you represent, and your particular area of interest when it comes to air pollution.
Thank you. Well, good afternoon, and thank you very much for the invitation. I'm Suzanne Bartington, so I'm the independent chair of the UAQ 100 Clean Air Network of strategic and combined authorities. I'm also an academic, clinical associate professor in environmental health at the University of Birmingham, an honorary consultant in public health, and also UK Clean Air champion working to translate evidence into policy and practice. I should also declare that I sit on the Department of Health and Social Care Committee on the medical effects of air pollutants as an expert member.
Excellent, thank you very much. Mr. Parks.
Good afternoon, everyone. I'm Tom Parks. I'm the Air Quality Programme Manager for the London Borough of Camden. And in my personal capacity, I'm also one of 2 lay members on the Committee on the Medical Effects of Air Pollutants.
Excellent, thank you. Councillor Porter.
Hello, I'm Councillor Jackie Porter. I'm the Cabinet Member with the Planning Portfolio at Winchester City Council. I previously had public protection in my area, and the air quality management area, and the strategy was formed under my control.
Excellent. Well, thank you. If I could start with you, Councillor Porter. We heard in the previous session that there were some issues on which what councils needed in order to better enforce this was greater powers. In some cases, they needed, for whatever reason, powers were not being enforced that currently existed, whether that be about resources, expertise, or anything else. From your perspective, are there any specific changes to planning powers that you believe that local government needs to better manage the impacts to air quality from development and particularly from construction?
I was really interested to hear that we're talking about it's a local issue that we're actually measuring, but it's a regional and national issue that we're actually creating this whole air quality issue. And Winchester District is a rural district, so a number of points really. I'm conscious of the principle that new development can't improve the failures of older development, and that's a real issue, I think. Clear countrywide construction standards. We could agree construction environmental management plans for each development. Simple, but the expectation of managing air quality during the development could be strengthened by national legislation. And we've currently got M3 Junction 9 being done. You can see the pall of dust sitting over the city. And also we have a situation where we were building flats to passive house standards and discovered that the builders were using diesel generators to do it. So those are 2 examples, but moving away from fossil fuel machinery to build, or even using HVO as an intermediate would be a good start. Clear status of air quality standards. Having heard the conversation we've just been having, don't know what those standards quite should be, but there's a new livability category of DC3 in the template for the new national standards, and actually there's an expectation for that national standard to be the same in every development, exactly the same points that have just been made. The support for those higher local national standards would allow planners to a clear route to reject or even mitigate without risk of appeal. And that includes major developments. Nationally significant infrastructure projects don't necessarily get the care for air quality from the inspectors, and it's often dismissed without a word. And stop solid fuel wood burning in all new properties by planning condition. That would be very easy to do, and it would be done. At the moment, it's still very difficult to do. The learning, I suppose, from some of this is the air quality standards. We've discovered, for instance, that the upside pavement of a road has far worse air quality than the downside when walking along it. So there are some quite simple things that we could perhaps learn within that livability conversation. And I think it ties up really with what Dr. Fuller said, which is that there's a lot more learning to be found to find out how people use the streets that we have. And then the next one is current air quality is always retrospective, so we need, exactly as was said in the previous case, if building control standards were set to be at the time of actual construction and kept right up to date as our knowledge of what the impact of air quality would be, bad air quality would be, then buildings would be built to the highest environmental standards at that time, and that would include positive ventilation and filtration if necessary. Bearing in mind that has a cost, of course. So we've got examples of that where old permissions for major development areas where build-out is slower, they're still building to previous standards effectively, and increased impact of air quality at height where we build more flats. We don't know the impact on families, many of whom are vulnerable in those higher level flats. And then if the number of residential, the risk of this is that we currently choose sites on a number of environmental considerations, just as being said earlier. Air quality being one, access to public transport is another. And at Winchester City Council, in our local plan, we do consider both of those in our environmental management standards. If the number of residential properties has to increase exponentially, which is as part of the government's plan for 1.5 million homes, those choices might not be possible. So, for instance, this year we chose one site over another in the same village because one was further away from the motorway than another one, and it would have affordable housing in it. That may not be an opportunity in the next one. And better consideration of other transport or freight operations wasn't considered as part of the M3 Junction 9. There could have been improvements to rail. It was decided to continue on the road. 82% of freight is managed by road when train would be cleaner. We have a current local plan approved in March this year which allows us to resist speculative development. It's a risk of many councils that they don't have this, and so poor air quality impact, as was mentioned in the last session, is lost in the appeal process. The inspectors don't really deal with it as part of the process, so it has to be built into such a fundamental issue that it's part of the appeal process, but also the opportunity to mitigate. And then finally, national parks plus districts. We have, in Winchester, we have a district where 40% of it is national park, and we're going to be joining with in local government reorganisation with the New Forest, where 86% of it is a national park, but we don't really know what the effect of all of this is on air quality. So I think that's another aspect that needs to be brought into the law.
Well, thank you. That's very helpful and full answer. I mean, as a local authority, wanting to ensure that there are enough affordable homes, recognising that you may have people living in, very imperfect accommodation now, and also recognising that if we keep applying higher standards, as you rightly say, there's a cost attached to that. Where does the balance between having the very highest environmental standards and making sure we're not making properties so expensive that we can't be made affordable? I mean, where do you sort of see that trade-off?
I mean, that is the challenge, because you start to get to a point where those houses are so unaffordable we don't build them. Winchester City Council has over 6,000 of their own council-owned properties. We've done quite an extensive retrofit on those. We have got quite a large, being a rural area, we've got a large area which doesn't have gas, so we've put in air source heat pumps onto those properties. It adds to the cost of living for those people, so we've also put on solar panels. The government legislation doesn't allow us to give them a battery, so we've pulled out of the whole process, which applies for money for grants for solar panels, because it's only practical to give people a battery as well. And then also those people tend to say, could we keep our wood burning stove please, or our open fire, because actually we can get wood, and if it's really cold we can't afford those bills. So not only is it more expensive to build them, it's also more expensive to live in them.
Yeah. And you mentioned you have 6,000 council properties. Are you building new ones at all?
Yes, we are.
And are you able to build those to these standards that you're expecting?
We're building them, and we're very carefully assessing the cost of them. And at the moment, the cost of them is extremely high. So actually what we have been doing is purchasing bulk purchases from our major development areas to increase the number of affordable homes in our major development areas.
Yeah. Okay, well, thank you.
So they're to high quality standards, but not necessarily to the highest quality.
No. And I mean, what changes would you like to see to the National Planning Policy Framework or the Local Air Quality Management Framework that would help?
Well, actually, in our air quality strategy, we have included internal livability. And we think that's really strongly a really important point. I'm really glad it was brought out in the previous one. A clear mention of air quality in the documents that becomes part of the national conversation at all levels within that. A clear link of developments to public transport. It's a SIPFA it's a SIPFA advisory thing, but actually public transport, getting people onto public transport the moment they move into those properties is one of the strongest ways of cutting down that pollutant. And greater enforcement powers. There's very little about that in the new MPPF. Enforcement is almost silent, and it was promised that it's coming later. It hasn't come, and it's still very weak. So we're always looking at things in the we're having to negotiate with developers rather than actually being able to enforce.
And Mr. Parks, I mean, you obviously also very much in local authority world, in a different perspective as an officer rather than as an elected member. I mean, is there anything that you would like to add to what we just heard there in terms of what further we could do to support councils, or how councils manage these trade-offs in a more urban setting in your case?
I completely agree with all the points that Councillor Porter's made. I think there's not too much I'd like to add really, but the point around enforcement I think is really critical. For authorities where we already have quite a degree of ambition for how we want new buildings to be constructed and new homes that are sustainable and safe for people to live in, we need to be able to take enforcement action if it subsequently turns out that they've not been built to the standards that are set out in building regulations. I don't think we have much of a grasp on whether new homes in this country are being built to the standards that we would expect. So even within the current set of building regulations, I think we could be doing a lot more to make sure that we're providing homes for people that are safe, that can be heated affordably, but that doesn't come at the cost of ventilation, and we're not trapping people in homes that are damp and mouldy and conducive to having really poor indoor air quality. I think there was a MHCLG report from 2019 that looked at a small sample of new build homes in the UK, and they found that the vast majority of those that they tested didn't meet the approved document F for ventilation. So we're already struggling. I think there's a lot more that could be done simply by providing local authorities with the recourse to take enforcement action if it turns out that new buildings haven't been built in a way that meets the
so you don't have the legal powers to do anything about that. It's not a resource issue.
I think largely a resource issue, but I'm not a planning expert myself, so I'm not entirely sure quite how viable it is to take a developer or a landlord down a legal route if it turns out that they've not met the ventilation standards. But it would require building control, or somebody, sort of a government agency, to be able to do the testing on these buildings to check whether they're fulfilling the standards. And if that's not happening, then there's no way we're knowing whether house builders are fulfilling the obligations. So I think a lot can be done just with better enforcement and resourcing for that.
Yeah, sorry, Councillor Porter, you want to...
Yeah, there are two aspects of that. One was the privatisation of building control. So on developments, people can choose who their building control officer is. So that takes away that completely independent response. And on large developments, they building control one property and not the others of a type. So we had a case where the ventilation in the bathroom just went up into the loft with no air hole out to the outside, and literally the roofs fell in. That falls to each person to take it back through NHBC if they're actually part of NHBC. Yeah. So that's a classic example, but I completely agree with you that there's no case to be made if you've got a single property. And the second one is being certain that that building control person has taken. So I think the privatisation really is tied up with it, which is that was really a huge failure in the system, that it does not give that independent advice.
Thank you. Manuela Pertegala.
Thank you, Chair. I have a couple of questions about accountability and local responsibility, and where local responsibility is and how this works. So my first question is for Councillor Porter. So obviously we're going through local government reorganisation, but in many areas, including in my constituency, we still have a two-tier local government where you have district and boroughs which have statutory duties to monitor air quality, yeah. And then you have the county councils which are in charge of transport planning, transport plans, which are in charge of where traffic lights are going to be sited, and also obviously they are the minerals and waste authorities, planning authorities. So, in your view, this model in the two-tier local government model, how does air quality monitoring data is used, for example, from city councils and district boroughs is used in, for example, transport strategic plans?
I have the advantage of being a double hatter. So actually, going back to that minerals and waste, I'm very concerned that certificate of lawful use for old H-size HGVs now becomes relevant for these massive lorries, and I personally took that to the inspection and asked for that to be included so that old CLUs did not count when you're calculating the impact of large HGVs and juggernauts on air quality and livability of healthy streets for people. So I'm absolutely committed to that. Winchester is a district that's going to be part of the local government reorganisation, and we do think that it's a great opportunity for the public health aspect of this to be brought into the mayoral authority arrangements, because it will give a consistency among the whole of the county of Hampshire, including Portsmouth and Southampton, to have a consistent quality standard for air quality. And was there another part of that question that you made? Oh, I know, yes, the third one was actually taking, as part of that work, we're taking the strategic transport team on a lived experience walk through a new development, because although it sounds great in public, nobody's using a bike, nobody's walking, they're all getting in their car. So there's something wrong with that, isn't there? So I suppose that knowledge, which we're hoping to have built up from this, will be used by the Department of Public Health, who actually were part of the team running our involved in our air quality strategy. I think it's practical. I think that's what local authorities are really good at doing, practical experience and seeing it on the ground.
Suzanne, do you want to
I'd just
add?
like to come in there. Thank you very much. I mean, certainly from a public health perspective, upstream primary prevention is really important. It's far more cost effective in the longer term as well to prevent these problems before they emerge. But certainly that potential to place public health sort of front and centre in terms of the planning process has major opportunities for both ambient and indoor air quality as well. I know we're focusing on outdoor ambient here, but we talk a lot about the need to reduce emissions at source, but there is also a role in reducing exposure. So we talk about reduce, extend, protect. So reduce at source, extend the distance between particularly vulnerable people and that emission source, and then where that's not possible, protect the most vulnerable. And that's really where a more holistic approach, a public health focused approach to the whole planning process can have major opportunities. And we hear from our members across the Clean Air Network, from our local government members, that there are some fantastic examples of public health leading the way in this regard. For example, Healthy Towns, Healthy Streets initiative, and adopting that. But at the moment, it's very much up to them to go above and beyond the current statutory consultation process. So it would be very encouraging, I think, to see a stronger focus on the role of public health and a public health-centred approach to informing that overall process.
Thank you. And Tom, would you like to add anything?
Yes, I would add, you asked about whether air quality monitoring data is used in transport planning and also how it's used in the planning process as well. One thing is that even where we have a significant amount of air quality monitoring data, if we're finding that we're already compliant with the legal limits in the UK, it becomes a lot more difficult for us to push for developers or for anybody who wants to do anything to go beyond those targets. So we're our ability to expect more in reducing and avoiding air pollution and reducing exposure to it is constrained by the conflict between our health understanding and the legal framework for air quality.
Thank you. And my next question, I'll start with you, Tom. How do you navigate the mismatch between local responsibility for air quality, so the statutory duty to monitor it and maybe to plan so that our residents don't live near quarries and so on, or other source of emissions, but also limited control over emission sources such as regional particulate matter or nitrogen dioxide, for example, so they are not under the local authority control?
It is really challenging. There's a bit of a conflict as well in that the more we talk to the public about air quality and try to build awareness around it, there is an understandable expectation that people feel that their local authorities should be able to protect them when they see a source of pollution that they understand is damaging their health. And in many cases we're finding now that we picked off lots of the quick wins by reducing vehicle transportation emissions. We're now at a position where what we have to do is more challenging by reducing emissions from building, but also understanding the sort of more niche contributions to air pollution, like commercial cooking, the transboundary sources of pollution that we might not necessarily be able to control within our own administrative area. We need to figure out an entirely new way of approaching a collaborative, I suppose, method for working with other authorities, either at local government level or national regulatory level, to try to figure out what we can do. I think we're in a position where there's a lot of sources of pollution, but we have so little evidence about what the specific mitigations are to reduce pollution from those sources. Is not to say that there won't be solutions to it, but we need to think, I think, more collectively about what we can do about it. But it is really difficult for a local authority to manage that contradiction. I think from Camden's perspective, we've benefited from the fact that the ultra-low emission zone has, as Dr. Fuller said, delivered transformational improvement in air quality alongside various other council schemes for reducing vehicle emissions and providing sustainable transport infrastructure. We're still seeing that air quality is far above the World Health Organization guideline limits. So we know that we need to do a lot more to try to better protect people's health, but we're running out of easy options for how we can do that.
Anyone else on the panel would like to add? Yes.
I think just to come in here, I think this is a real key advantage of combined authorities as well, where you can work collectively. Air pollution doesn't stay within administrative boundaries. Clearly, joint working is really, really important, and partnerships. And again, we've seen some fantastic examples, and obviously the Mayor of London very much leading the way, but we're seeing that elsewhere across the country being replicated. I think absolutely key, though, is that, and what we hear again, is that control over national, for example, national infrastructure such as national highways, the motorway network, for example, freight and rail comes up again and again as being those areas that are more challenging for local authorities to be able to act on, and that's where it's really important to have that local and national coordination. Land use as well is another important one, because we know there's also a challenge, of course, with ammonia as a source of PM, and yet that again is something which is very challenging for local authorities to address. So that's where we need that local national coordination, but there's a clear role as we see those powers being devolved as well.
Thank you. And finally, what responsibility or responsibilities should developers take for air pollution beyond Section 106 contributions? Tom?
Excuse me. I think there's a significant need for a more distributed sense of responsibility with developers as well. We talked earlier on about how new homes are being built and not necessarily fulfilling ventilation standards. So I think first and foremost is making sure that buildings, whatever their purpose, are built in a way that satisfies existing building regulatory standards, but also work constructively with regulatory authorities to explore improving standards as well. The way that buildings are constructed also needs to be considered, and Councillor Porter mentioned that there's a significant opportunity to have a national sort of a control framework for construction machinery. In London, we already have the non-road mobile machinery low emission zone, which has been extremely effective in reducing construction emissions from diesel machinery. There is now an established market for stage 4 and stage 5 construction machinery, and some of the major infrastructure projects are already trialling the use of hybrid machines, and there's nothing to stop this approach being replicated elsewhere in the UK. So it's not that there's a lack of opportunity to do something positive, but I think there is a need for a sort of a coherent national framework of action for reducing emissions during construction, but also from buildings once they're completed and in use. And that will require developers to be involved in recognising the importance of providing buildings that can be used and can be occupied safely and healthily by people using them, but also don't have a detrimental impact on the people already in the areas where development takes place. I think that's particularly important if the proposed changes to the National Planning Policy Framework talk about densification and presumed focus on building new houses in areas that are already quite built up. there's already a lot of people living there, potentially with already quite high exposure to air pollution, so we need to make sure there is a sufficient protection for the health of people to try to tackle the health inequality that we all know air quality exacerbates.
Thank you. Anyone else on the panel?
I think that going back to that, actually, we took inspiration actually from the London principles of using non-diesel machinery. We thought it was a really positive conversation. But we may be able to, well, we have about air quality in a supplementary planning document. Supplementary planning documents are going to lose their value. We're going to have to find a way of entrenching this back into a local plan, and local plans are going to be templated. So if you're going to template it, you need to include this in the local planning system. Because unless we make sure all of these things are templated, they won't be there, because the documents are currently this wide and they're going to be this big. So all of these things need to be templated in the national systems if we're going to get somewhere with them.
Thank you very much. Sammy Wilson.
Okay. We've heard from both yourselves and the previous witnesses that the collection of data is important when it comes to judging the quality and what's happening with quality. How are air quality monitors managed and maintained by local authorities?
I think Tom will probably go into it as an officer point of view. Do you want to do the officer point of view first? Is that easiest?
I'm happy to do that. Sure. So I think for local authorities where there is already an understood exceedance of one of the limit values, there is an obligation to do more monitoring to understand the extent of that and to continue to monitor whether their compliance is subsequently achieved. There is a fairly limited set of monitoring methodologies that can be used to produce the level of statutory data that can be compared to legal limits. The technologies themselves are quite specific and they're quite complicated, so there's a relatively small pool of companies that provide the types of analysers that can provide the data of a sufficient quality for us to use for these purposes. So ultimately it does end up becoming quite an expensive endeavour, and the nature of the equipment means that we have, I suppose, to choose very specifically where we monitor at a few select locations. So inadvertently we don't end up with a fantastic coverage of data from the highest quality monitors, and that means that there's a lot of grey areas in the monitoring network. So we probably have a good understanding about generally what is happening to local authority air quality in areas that have historically been pollution hotspots. But beyond that, there's a limitation to our knowledge, and particularly now that road transport emissions have reduced a lot, it's a lot more difficult for us to understand the balance of what's happening from building emissions and from construction emissions and from transboundary pollution as well that we've heard earlier on.
Yeah, thank you. Absolutely agree with all of the comments that Tom has made. I mean, one of the other challenges, particularly if we're looking at this from a sort of health research perspective as well, where we need to obviously draw upon that monitoring data, is that there is often fragmented or incomplete coverage of data, and we have particularly gaps. If we look at rural areas, for example, we've got that inconsistency nationally, and also limited measurements. We talked about modelling and measurements in the previous session, I know, but those measurements are also really important for validating models, and those models fill in the gaps between those measurements. So if we want to do high quality health assessment of impacts and understand the impacts on vulnerable groups in particular, that monitoring coverage is extremely important. It's extremely important to reflect where people live as well and where those vulnerable communities live. And at the moment, that doesn't really feature in terms of where monitoring is based.
Just go on from that. We've got, just as Tom said, we've got expensive machines that you have to get planning permission to put in the right place, and in a conservation area that's a nightmare. We have got cheaper machines that cost about £7,000 or £8,000, which are very responsive and provide excellent. There's EarthSense type ones which provide very responsive detail, and you can look at them and find out what they're doing at 7 o'clock at night, and the public can too. And we have NO2 monitors which you attach to the street lights or whatever it is, just above the height of where someone can easily reach it and take it home with them, and you can get a really good sense of those. But at Winchester City Council we have that data actually analysed outside. We don't have the expertise within our system and with our staff to actually analyse it ourselves, so we pay to have that done. That's part of the budget that we have. And I'm told by my officers that it's a huge miss that it allows us to publish locally that data, but it's quite difficult to understand. The data is quite difficult to understand, and it's difficult to compare, so the public can't compare it particularly easily. And there's really an opportunity for a national database run by DEFRA so that everybody can see it as publicly understandable, accessible information. I think that goes back to what we were saying, that the public start to want to know. We've got those people, I mean, in consultations, we've never had such diametrically opposed responses. Basically, some tell us to go away in the nicest possible way and don't get involved in my life, and then some say, but we want you to control every part of our lives. And so having more and more data is fine, but we need it to be publicly understood and accessible data.
All of you have pointed out that, first of all, the equipment is expensive, and then the use of the data from the equipment is expensive and sometimes has to be brought in expertise. And in earlier evidence today, we heard that one of the problems with using limit values is that once you've reached the limit values, then the view is the problem's been solved, and why would you keep on using expensive equipment and use the analysis of that if it's costing local authority money? Is that a common problem that, look, limit values have they're useful, but once local authorities feel that they've dealt with the issue, a low priority will be keep on the monitoring?
I mean that's an incredibly important point. I was looking at the cost of our monitoring in Camden. So Camden, we have an extremely extensive network of diffusion tube nitrogen dioxide monitoring, and 4 or 5 automatic monitoring sites in the borough as well. The annual cost of that is about the same as 2 social workers. So for local authorities that are already under immense financial pressures, if you've already achieved the legal limits and you're no longer legally obliged to continue monitoring and producing status reports and air quality action plans, if you can back out of that and instead use that money to do something else that is essential in your local authority area, then it's understandable that there would be a relaxation of impetus in certain local authority areas on their work to improve air quality. But I think ultimately, Dr. Bartington made the point that having a health perspective on why we need an air quality framework is so important, because it's widely recognised, I think, that there isn't a safe level of exposure to particulate matter air pollution. We know that for various different types of pollutants, there is potentially some evidence that the degrees of health effects are maybe greater at lower levels of concentration. So it's always going to be worthwhile doing more to try and improve air quality. So I think excessively focusing on limit values, as you say, it really does lead us into a position of there being a real risk that in many parts of the country we start to lose the work that has been going on to try to improve air quality. And once we lose the monitoring network, we don't know what's happening. So it could be that a new polluting activity or, really an industry, potentially something may be going wrong inadvertently, but we wouldn't know it's happening if we don't have the monitoring capability.
Just one additional point, that data is absolutely critical as well for understanding the most effective intervention. So to be able to understand what is happening in a local area, what the improvements are actually attributable to in terms of changes that are being made, that data is so important. And it's really important to have that over a long time period as well, to be able to really do robust studies that understand the impacts, for example, of low emission zones and other interventions. So that data is critical, and that high quality complete coverage of data is also really important. And certainly, yes, we have heard instances of equipment being decommissioned just because of this issue about meeting legal obligations, yet we know that actually we need to pursue that continuous improvement from a public health perspective.
How flexible are local authorities? We heard that there can be spikes of air pollution. A construction site, for example, I look at some of the construction sites here in London, the large construction sites. This isn't for a year or a couple of years. It can be a decade. So how flexible are local authorities? You may have reached and tick the box, for traffic pollution or whatever, and then finding here's another location we should be monitoring. Is there a great deal of flexibility with local authorities identifying those sites and then spending the money on maybe moving monitors or putting new monitors in?
Well, I think this is where there's an opportunity for to place a responsibility on developers. So I think in many London boroughs, there are planning conditions that require an assessment of the air quality impacts during the construction phase. So an air quality dust risk assessment will look at existing air quality, the nature of what's being done on that site, and the proximity of surrounding people, and particularly vulnerable residents or schools or healthcare facilities. And if that sort of calculation deems that there's a moderate or worse dust risk, then there is an expectation of requirement for real-time construction dust monitoring on the site boundary. Again, that's something that could easily be mandated or used elsewhere in the UK, but it is effective as long as you have the local authority scrutinising the data and you have planning conditions or other Section 106 expectations that require the developer or the contractor to be routinely sending monitoring reports and reporting when there are exceedances of limit values.
Thank you. I'm going to try and move us on if I can, please, Sammy. Did you want to just make a quick point?
In smaller authorities, I think that is asking a lot, and I don't think it happens. Which again is important of going back to the whole district and the public. I'm going to bring
Carla Denyer in for a quick question, then we're going to go to Martin Rhodes.
Thank you. I was just about to loop us back to planning enforcement, which you sort of got me halfway there. The discussion earlier about planning rules and planning conditions are only as good as the enforcement. That sort of rang, very true to me in my experience as an MP and a former councillor, and talking to colleagues elsewhere in the country as well, that I think many council planning enforcement departments are so underfunded that they can only work reactively. I don't know of any planning enforcement departments that are proactively checking that developers are sticking to their planning conditions at all, and even reactively. I thought I half remembered something, so I've looked it up, and the local government ombudsman did a specific report on how underfunded planning enforcement departments are, and that in many cases the delays are so long that the deadline to take action has passed, and so there are effectively no planning rules in those areas because they can't enforce it when developers do the wrong thing. So acknowledging that none of you are planning officers or in your planning departments directly, but I'd be interested in your experience on whether that's the case in your council, because that to me seems like a clear recommendation that we could include, of making sure that enforcement and building control council departments are funded enough to actually make sure this stuff happens.
First?
Yeah.
Enforcement is a power and not a duty currently, and therefore it's not funded through the planning system. Even in the new planning finance arrangements, it's still not there, and it will always be that it'll be looking at the priorities, and currently air quality would be quite low down in those priorities. Generally, it's a matter of if someone complains, someone will go out, have a conversation and act on persuasion, unless there has been a construction management plan for a larger development where there is a requirement. But nevertheless, we'd probably still use individual modelling on that site, or measurement on that site, just for a few days, not for a long period of time. I'm being honest there.
I'm going to bring Barry Gardner in now on this, and then we'll continue.
Thank you, Chair. You also spoke about building control, which I think is very important. And just wanted you to elaborate on the point that you made about the privatisation of building control. What is it precisely that building control can compete on?
Building control can compete because a developer can choose their building control officer, and they are competitive, and the councils have a fixed rate. They also are not necessarily required to check every single property of a type. They can check others of those. I actually personally have a friend who is a surveyor and runs a website where surveyors come in and bid for schemes to be the building inspector of. So I'd say that the only real competition is price, but actually also possibly independence.
Yes, and and of course, in reality, what we know is that, given the nature of the construction industry and the subcontracting nature of that industry, that often margins are made by shortcuts, and that if you're an independent building control officer, then what you can also compete on is speed of the construction being enabled, and that means not doing all the checks on things like fire stopping between the buildings, or in your case the mention that you made of the ventilation going up into the air duct, the roof duct.
I wouldn't like to say that every single case is a matter of professionalism and quality of the person doing the work. It's purely the system as it currently stands.
But would you like to see a system whereby we were back to building control being an exclusive function of the local planning authority and then properly financed?
I think that would be a really huge change, which I would personally welcome, and I know that my authority would welcome. The challenge would then be to upskill the local authorities, because at the moment the current systems and the recent changes have made it even more difficult for local authorities to be competitive in this area, and that is another challenge.
Thank you.
I mean, just on that, I'm assuming that we're accepting that building controllers, professionals, are doing a job competently. They're not just sort of waving stuff through because they're getting a check for it. Government are very keen to reduce the barriers to getting things built, and we know local government's constantly under pressure, and local government planning departments are sometimes taking longer to complete things already. I mean, how confident would you be that if we move to a sort of entirely local authority, sort of state-run building control programme, that we wouldn't be adding further delays into the system?
Well, that's what I'm saying. I'm not querying the professionalism of the individual that's doing the work, and I also know that there would be a challenge to the capacity of local authorities to sign off every individual house. At the moment, they often end up running the case for each individual property, particularly individual individual householders that are doing that work, not for the mega builders, and that's another piece of work in itself, really, to encourage those large builders to be looking at this as part of air quality, as perhaps part of that conversation we were having earlier.
And would you think that building control staff working for a local authority will be better or less well paid than someone doing it privately for themselves?
I can't tell. I can't.
No. Okay. Fair enough. I'm going to bring Sarah Gibson in.
Just a quick question. Given the challenges around bringing building control back into local authority exclusive control, which we've just highlighted, is there therefore merely an argument for making sure that building control officers are a registered profession and therefore accountable to an organisation that they can therefore be struck off from, in which case they would have the legal responsibilities and it would be easier to make them more accountable on your part?
In my political sense, I would say yes, but I think that's something to ask Mr. Parks.
I don't know enough about the building control profession to be able to make a judgment on that. I suppose I would just offer that from my perspective in Camden, we tend to work most closely with building control when looking at existing buildings, and where there are issues, for example, with the installation of solid fuel kitchen facilities. And in many cases, we've experienced that there are restaurants in Camden sort of chucking out levels of smoke that are clearly very detrimental to public health, and there's a real need for building control to have the capability and the resourcing to take responsive investigative work in these cases, but they are so stretched that it can be really difficult, and people are living in situations where they're right next to a really polluting premises, and we're being emailed people desperate for help, and it's really challenging.
Yeah, I wasn't suggesting that building control should disappear from local authorities in any way whatsoever. I was merely thinking of the huge volume of new build that would, therefore a registered profession might sort that.
If I may say, I just think it's a really interesting point because it was brought out by the previous hearing about building control, and it would be interesting to pursue this a little bit more, because we can all see that there's an experience there of a potential deadlock, that we don't want to be creating a problem that houses can't be occupied just because we haven't had them checked. But we do also know that in terms of quality of build, but also quality of livability, that is safety. Potentially a challenge.
Well, we've promised him for some time, but we are now going to deliver. Is Martin Rhodes.
Thank you, Chair. Dr. Bartington, in terms of your knowledge and experience in terms of Birmingham and the clean air zone there, what would you say are the biggest successes, some of the limitations that might be there, and in terms of, if others would sort of be looking at introducing such a scheme, what should they be looking for in terms of learning from this, in terms of the things to introduce and the things to avoid?
Yeah, thank you. A very, very important question, and I know we touched on low emission zones, clean air zones in the previous session, and some of the history and background to them. I mean, certainly the experience in Birmingham, we can draw upon both a research perspective and what we've experienced in terms of collaboration with Birmingham City Council as well. So we know from published evidence that the clean air zone in Birmingham has been effective in terms of reducing roadside nitrogen dioxide, so that reduced by 3.5% within the clean air zone, and that analysis also took account for the fact that nitrogen dioxide is going down anyway nationally, and that's due to fleet turnover. All the time people are getting rid of older vehicles and getting newer ones, and as we heard already, in terms of emission standards over time improving in that regard. So yes, in terms of that initial focus of the clean air zone, which was to achieve compliance with nitrogen dioxide, NO2, in terms of achieving legal limit compliance. However, having said that, challenges do remain, so there are still some exceedances when we look at legal limit values. We still have central Birmingham, and indeed the wider city as well, exceeding World Health Organization health-based guidelines, and we have had very limited evidence of any impact on particles, which actually are responsible for the greatest health burden in the city. To put that into geographical context as well, Birmingham, a city of over 1 million residents, the clean air zone actually only affects a geographical area of around 50 to 60,000 people. I mean, obviously that's also an important area in the centre of the city where many other people come and visit and come in for work, etc. But when we look at it geographically, it's very small in relation to the whole city. And drawing upon the discussion earlier about where those vulnerabilities exist, if you were to draw that clean air zone from scratch, so to speak, looking at where the greatest health burden is from NO2, it might look somewhat different as well. There are lessons, I think the second part of your question about lessons learned is a really important one, and that's very much the essence as well of the UK 100 Clean Air Network, to share those experiences so we're not reinventing those across different authorities. So certainly there's been a lot of lessons learned about engagement with communities and the importance of investing that as being important as much as the infrastructure that is needed to implement and monitor, but actually to engage and invest in communications, in this case the Bron Breathes programme, and many of the lessons learned about how to frame that messaging about air pollution and harms to health has certainly been very prominent as well. I think just to add finally that the future-proofing is obviously very important. So I mentioned over time that national fleets are overall nationally is becoming cleaner. Obviously, if we keep emission standards as being a Euro 6 diesel and a Euro 4 petrol car is essentially compliant, then over time that proportion of vehicles is going to become less and less. And to look at future-proofing the zone, clearly we need to look at some other examples of greater ambition as well. I know the Oxford Zero Emission Zone is one of those. There are others outside the UK as well. But clearly to future-proof it over time, that is really important, given it was conceived before we had even had a national ban on sale of petrol and diesel vehicles announced.
Thanks. And just to go back in terms of, you were saying it's been successful in terms of nitrogen dioxide, but hasn't been so successful in terms of particles. What is it about that particular scheme that's led to that divergence in terms of impact?
Yeah, again, it's a very important question, and it's been a real focus of academic research as well. That primarily is because of the dominant sources of pollution. So nitrogen dioxide, typically, if we look in central Birmingham, where road transport is a key source of NO2 pollution, and that is less influenced by those wider sources outside the city. Whereas we look at PM particles, there's a far broader range of sources. So domestic combustion, and in fact we published another paper which showed that wood burning actually contributes around the same proportion of primary PM as does road transport. So there are other sources, domestic combustion, industry, etc., agriculture already touched on. And also, this wasn't actually conceived as being an intervention to reduce PM. So if we're assessing it on what it was intended to do, then yes, but it wasn't actually intended to reduce PM pollution. Of course, there is the outstanding question about brake and tyre wear and non-exhaust emissions, which are a source of particles. And again, this is very much focused on reducing tailpipe emissions.
Okay. And just your comment about, in terms of the area covered, traditionally, in terms of, we look at these areas, we think of city centres. And is it now, perhaps, in terms of as the nature of pollution is changing, if you're saying that nationally, because of changes in terms of the way cars and transport and so on, therefore, should we be looking at other areas as more of a priority? Is that one of the lessons to learn from this?
It certainly is a lesson learned in terms of scale, geographical scale and ambition, and clearly if we look at the ultra low emission zone in London, the geographical scale, notably with the expansion of course to Greater London, is far larger in scope. But again, research has shown that actually you get that sort of diminishing return over time, simply, as I said, because there are fewer and fewer vehicles that are actually affected by the emission standards. Yes, I mean, scale, just picking up on the Birmingham example, because it is part of the West Midlands Combined Authority, and the West Midlands Combined Authority with 7 constituent local authorities have actually come together to create a framework to address particulate pollution. So there's a real recognition regionally that they need that joint working, they need to be working together. And working with other partners such as ourselves, and also Health Service is really important here as well. But to really address that wider range of sources on that geographical scale. So we're looking at a population of around 3 million in the Combined Authority area.
Yeah. And just widening out from that particular example in terms of Birmingham, the clean air zone, but to actually talk more generally about what local authorities can do in terms of the different types of instruments they have, in terms of low emission zones, school streets, retrofit of housing, all these various things. And I open this up to everyone on the panel in terms of what do you see as in terms of being the most cost effective in terms of cost benefit analysis of using that, of those different types of measures that would get improvement. I don't know if you want to start, Dr. Barnes, and then I'll go on to your colleagues.
Yeah, absolutely. So in terms of cost-benefit analysis, obviously it's really important to have very comprehensive data, and in particular on the health outcomes as well. So I think we already touched earlier on the example of Bradford. So the approach to the clean air zone, which is of course a different class of clean air zone versus Birmingham, which is a Class D. But that really had substantive public health input from the outset, and research has also been wrapped around it to really understand the health impact, and as well as cost-benefit analysis. But that really has demonstrated a reduction in terms of GP consultations for respiratory symptoms, and also an NHS saving of around £30,000 per month, which obviously is significant. So certainly, if constructed with sufficient ambition and implemented well with appropriate holistic measures as well, we can see those savings. There are other examples. Currently, we are undertaking an evaluation of the zero-emission bus Zebra scheme in Oxford City, and preliminary evidence suggests a major impact on NO2, and full cost-benefit analysis is still to be undertaken, but all indications are that actually that is a very cost-effective intervention. There are other examples, of course, but I'll hand to colleagues for those.
Okay, Mr. Parks.
I think Dr. Bartington's point about using data is really important as well. From my perspective, I think we perhaps underinvest in the scientific research capability in the UK to make really informed policy judgments and to do cost-benefit analyses for significant policy decisions around air quality. So I think as a lay member on the Committee on the Medical Effects of Air Pollutants, it's been a privilege to see how scientific advisory committees work in producing analyses that help to create really robust policy decisions. But it seems evident that a lot of academics are doing this as an aside to their day jobs. There are more questions, I think, that we would want to ask than the scientific advisory committees have time or resourcing to answer. I think that results in us being a bit blind in some of the policy decisions that we make. So it's actually quite hard to answer the question about what is the most cost-effective intervention for a particular local authority area if we don't know what the cost is for doing a particular intervention. So for Camden, for example, the modelling data for London, the London Atmospheric Emissions Inventory, suggests that commercial kitchens are the single largest source of fine particulate matter air pollution. But we have so little evidence about what the different composition of mitigation strategies are that would help us to develop a programme of reducing that in a way that supports businesses and supports the economy. We can't really make an informed judgment about how that stacks up against, for example, healthy school streets, clean air zones and vehicle control measures. I think a final thing I'd like to say on this really is we talked already about non-road mobile machinery. I think that's an obvious one in many parts of the country. But indoor air quality, we don't have, I think, an estimate for the total mortality burden in the UK for indoor air pollution. But I think the French Public Health Authority has estimated that 20,000 premature deaths in France out of a total of 40,000 air pollution deaths are attributable to indoor air pollution. So I think it's not inconceivable that we might have a similar impact from indoor air pollution in the UK. So we need to be really careful not to focus exclusively on the outdoor environment when the indoor spaces that people are spending most of our time in may still be really polluted, whether that's at home or at work or in schools or other public buildings.
Thank you. Councillor Borton.
Thank you. Well, bearing in mind that we were trying to get rid of NO2, and I think that's the very key point that's been made here, really. And we took to having car parking zones, which we've been doing over the years, and getting gradually the central ones much more expensive and the outer ones much cheaper. So that means that the park and ride becomes useful, and we're still planning more of those. The housing retrofit, as we've said before, many were not on gas, and so they were using wood almost exclusively if they weren't managing to cope with electricity. So that's been very good, but we've installed solar power there too. So those buildings, and insulated them, so it actually is improving the emissions outside as well as in. Encouraging HVO, including all our waste vehicles. Council vehicles are now all electric. That meant in many cases some long lead times, but it's been worth it because we've now all vehicles are electric. A high uptake of EV in Winchester, appreciating we've still got tailpipe emissions, but from those EVs we were one of the first districts to actually part fund our own EV charging points in all of our car parks. and that's been very well received. And because it's an arrangement that we can upgrade them as we need to, that's been very worthwhile. And we welcomed a major new charging facility run by a private company for cars and lorries alongside the A34, which is also the E1. We've worked with other authorities to piggyback onto government funding for Burn Better campaign. I have to say, some public love it, some people hate it. And the two areas where we're struggling, to be realistic, is the greener last mile delivery. We need to think again about how to do that, particularly in an area where the city isn't that big anyway. It doesn't seem obvious. And make it easier for taxi drivers to use electric cars. We very, very clearly have tried to lessen the demands on those electric car drivers, but it's still very expensive for a taxi driver to use an electric car. And so these are the two areas where more funding would make a difference, actually. We could try harder.
Thank you very much.
Just one additional point is that at present we recognise that most of the health benefits, in terms of the economic benefits, it's an underestimate. So COMEP at present is working through a whole list of morbidity outcomes to reconsider the relationships, exposure-response relationships with air pollution, and therefore that will obviously impact upon those economic benefits. And of course there's a cost to doing nothing as well that needs to be taken into account. Our Royal College of Physicians report estimated that if we include dementia, then actually the costs of air pollution in 2025 increased to nearly 50 billion. So there is that cost of inaction as well as the benefits of action.
Thank you very much. Yep. Julia Buckley.
Yeah, thank you, Chair. So I just wanted to pick up on some points that you've each mentioned around the issues with funding and how the changing funding landscape for councils has put pressure on their ability to tackle this. Could I start with yourself, Councillor Porter? I recognise you just touched upon some capital funding around EV chargers and private investment, but earlier on when you were talking about the struggles around the monitoring and so on, do you want to talk us through your views around that and around the funding landscape?
I mean, I know many of you have been councillors yourselves, and so you also probably am speaking to the converted, really. But the funding from the government was small. I mean, £6 million. It was really not particularly dramatic, and it struggled to filter down to those smaller district councils, particularly. The application process was geared towards large sums, and perhaps quite rightly, but it meant for the smaller sums, the whole process was very clunky and very difficult to do. For smaller councils with officers who have got multiple responsibilities, it wasn't exactly the top of the list of jobs. So I think there could have been a simpler system for funding for perhaps 20 to 50k plans. More funding would result in more resource. And I think that the conversation about particulates has been really interesting today, and that's, I think, perhaps where some of the resource needs to be looked at. Government should take more of a national position on air quality, thus reducing the cost of NHS. It's obvious, we've all said it, but it'd be interesting to see if the NHS see that as a real money-saving process, and whether the Department of Public Health and the NHS can look at that as a joint funding outcome. We think we're able to do this work and can see the impact on our health of our more vulnerable residents. But we also know that we need that evidence from public health. So I think there's a funding need there. And we have the advantage in Winchester of Southampton University with considerable expertise. Professor Stephen Holgate and works with us and works with other districts in Clean Air South. So we also think that there's a real value in putting funding in through that system, so that the expertise is coming through very able scientists through our local authorities.
That's really interesting, thank you. And yourself, Tom Parks, do you have any thoughts on that sort of cross-departmental saving or joint funded initiatives?
I think I completely agree with the points that Councillor Porter's made around the 6 million grant, which was, I think, taken away anyway, across 317 local authorities in England isn't really going to go very far. But we have nevertheless been able to do some really powerful projects in Camden from the DEFRA Air Quality Grant Scheme when it did exist and when we were successful in bidding for grant funding. Part of the challenge for any subsequent funding scheme, I think, would need to make sure that it's not just about capital investment. We've heard a lot about how providing local authorities with the resource in terms of personnel to proactively deliver projects and engage with communities, to work on policy at a local level and set new standards for what we expect, is just as impactful potentially as a capital investment in a suite of new electric vehicle charging points. So I think any funding scheme would need to be long term enough that you can provide the continuity in bringing in or creating a new role for a local authority for someone to do over a few years. And that would also mean that the match funding expectation shouldn't be so onerous that already cash-strapped local authorities aren't required to have to find funding from somewhere to match what we bring in terms of grant, which I think in some cases has priced some local authorities out of being able to apply for funding in the past. But I completely agree with the idea that any new funding scheme for local authorities should take the view that we're investing in cleaner air. It's a preventative mechanism, and by having cleaner air, we're avoiding costs elsewhere in the health system. So having a more holistic assessment of, if we're able to reduce air pollution in our local authority by this much, even if it's just for a particular group of people, if we had an estimation for how much that would avoid in terms of healthcare costs for children going to the GP with asthma or missing school days, it would become a lot easier for us to justify why we invest up front. I think we don't necessarily have those figures, or if they exist, they're not joined up in the way that could really unlock a powerful opportunity for investing in clean air.
Cabinet Office would say if you could show the cross-departmental saving, you can then transfer across the budget line. So what I think you're saying is about mainstreaming these roles under the public health function in a council, which is then back funded through Department for Health. The suggestions you're making are really helpful when we bring together our recommendations. So I'll just bring in Dr. Bartington if you've got any final points really around what funding or regulatory changes you think would be most beneficial for councils to work in this area.
Certainly, and this has been raised by UK 100 members in our Clean Air Network, that mismatch at the moment between funding and policy cycles, and the fact that we're actually trying to address a long-term issue is a real problem. Obviously, loss of the DEFRA Quality Grant affected many and really exciting projects that were being delivered, etc., that unfortunately couldn't continue. In terms of what we would want to see, I spoke already earlier about that opportunity in terms of devolution of powers, but certainly in terms of the public health function. There's been some very imaginative cases, I think, of tapping into various small pots of public health money, but no sort of consistent way of doing that in terms of creating the business case for interventions. And really, this is a health issue. I mean, air quality is the largest environmental risk to health. It is responsible for around 30,000 early deaths each year, and it is a significant impact on people's daily lives. Public health is ideally positioned to be able to coordinate and take action on air quality, but it does need to have that funding behind it. I should just finally add that we do have the tools now to better be able to appraise interventions, to understand their economic benefits, and to be able to create the business case. And there are benefits beyond air quality. I mean, I know that's the remit here of the committee, but clearly many of these interventions have noise co-benefits. Active travel, a third of the population are physically inactive. There's a significant economic benefit and saving to the NHS there. So tying this into the NHS long-term plan, clearly the need to invest in prevention, and it has the best overall return on investment.
Thank you very much. Last but not least, Jonathan Davies.
Thank you, Chair. One of the things that has come through this session today is it's quite a chaotic space in terms of all the stakeholders that there are. They've all got different priorities and different pressures, and even if this is considered a public health issue or an environmental one, obviously local authorities have got a role to play. but do you feel there is sufficient engagement with central government to support the understanding of requirements and statutory duties to be enacted by local government? I wonder if I might start with you, Dr. Bartington.
Well, we certainly can be improved, absolutely. I mean, just to pick one key area, because there are several, but one prominent area that local authorities have repeatedly said is really we need that coordinated public health campaign around air quality. If the public don't clearly understand the issue of air quality, and many don't, I mean, I know I work in this area and have done for many years, so it's bread and butter, but you go out to speak to people on the doorsteps and it's not necessarily top of their list, and particularly indoor air quality, which has lagged behind outdoor. So that really, to me, as a public health profession, is fundamental, because it then creates understanding. Knowledge is power, but also acceptance of measures. So local authorities at the moment are grappling with all this issue about disinformation and misinformation, public backlash, which is creating all sorts of difficulties with implementation on the ground. I've certainly seen it myself. But if we have that coordinated national public health campaign, as we have done for smoking, alcohol, road traffic accidents, etc., great examples, then it really paves the way for action. So I think that there would be the priority. There are others, of course, which are really important, and long-term funding, capacity building, workforce skills development, but to me that's a really important one.
In terms of the relationships that local authorities have, it's mostly through MHCLG, and then there will be DHSC as well in there. Do you actually think that this whole kind of piece of work should be taken off DEFRA and given to DHSC or MHCLG?
Well, certainly air quality is a health issue. I mean, I know it's obviously been historically owned by DEFRA and handled as an environmental challenge, but we as Clean Air Champions have been very clear about it being addressed as a health concern primarily. I think just to add to that, it's the coordination across government that's critical, because it doesn't sit neatly in one government department. So DFT clearly has an important role, MHCLG, DEFRA, but ultimately the benefits really lie with health and social care in terms of NHS and social care savings. So yes, I mean, my personal opinion is that yes, it should be seen as a health challenge, as we do with other public health challenges, but I appreciate it's not quite as straightforward as that. Indoor air quality, clearly there is a real opportunity there for that to be looked at in terms of where it sits across government, and I know that that's an ongoing conversation.
I wonder if I might come to you, Mr. Parks, in terms of the opportunities to engage with central government as a local authority. I know that there's issues with the data, how it's collected, where it's being collected, where the local authorities may even have a perverse incentive to not collect data. I think, would I be right in saying that DEFRA's local air quality management support website and portal is the principal interface between councils and government to understand this issue?
I'd say it is to an extent. It's the main source of information. It's where we find updated data ratification statistics, and where we would upload various different, our annual status reports that we have to do as well. I think at the moment there is a very limited degree of interaction that we have directly with DEFRA. It would be valuable to have a greater degree of communication, I think, with government departments. Every local authority has a different challenge in terms of managing how air pollution affects public health. I think the less effort there is in communicating as effectively as possible with the breadth of different local authorities there are in England, the weaker sort of national policy decisions. So I would strongly encourage a more robust approach for bringing local authorities into the process of designing policy, testing how it could work, and it being more of a cooperative process. I would also strongly agree with the idea that there needs to be a much stronger health lens with how we assess how we regulate the problem of air pollution in the UK. So we talked earlier on about the fact that once you meet emission limit targets, it's easy for a local authority to kind of switch off its monitoring and think that an environmental problem is perhaps now no longer a problem. But if we think about the fact that there is still a health risk even at levels below these, then it hopefully would retain that sense of responsibility to continue working on improving air quality, even if you've met a notional environmental target for air pollution. So I think there's a significant opportunity for better collaborative working, but also involving more government departments and government agencies.
That's very helpful, thank you. When you put the data in through the local air quality management support website and portal, does anyone ever come back to you or does it just sort of sit there?
I can only answer for an experience of a London local authority. So the GLA, the Greater London Authority, holds London boroughs accountable for fulfilling that duty. They do check our reports, so they will pick up on any data errors and require us to make improvements or to provide additional content in our status reports. So there is a degree of scrutiny. I don't know what the situation is.
Lead to any enforcement, are you aware, within London?
Not that I'm aware of. We've never had enforcement issues in Camden. I think there are some local authorities perhaps where they haven't submitted on time or there's been a long delay. I can't say what the outcome has been, if there has been any enforcement action.
I wonder if I might just come to you, Councillor Porter. Obviously, you represent an area which is somewhat different to where Mr. Parks.
We actually do continue to monitor the place that was the worst in our air quality management area, and we are aiming for better quality, a better standard by 2030. So we have gone to 30 micrograms per cubic metre for NO2, and set a PM 2.5 level that we think is achievable, but nevertheless challenging. So we retained our monitor at that site. So going back to the point about whether there is a relationship between national government, I completely agree with what was said earlier about getting the public to understand the health benefits of better air quality and the health detriment of poor air quality. It's, I think, the biggest subject that we need to be challenging. A lot of people use the BBC website to find out what the air quality is like in their area, because you can put your postcode in and it tells you whether you're average, poor or good, and they use that, and actually to have that detail of the DEFRA site well explained would be helpful. But I would say, for me, I completely agree with your point about having the need to make it what I call a seatbelt moment, when the whole country thinks, do you know what, this is the right thing we've got to do. And the compliance is huge because they just understand. And for me, that's the point we've got to get to, as which MHCLG could really help with, and Department of Public Health could really help with, which would make our jobs a lot easier in local authorities.
Thank you.
Thank you very much. One final question from Barry Gardner.
Thank you, Chair. All of you on the panel have said how important it is that the Department of Health should regard this with greater focus. So would you be keen that this committee in its recommendations were to make a recommendation along the lines that the Department of Health report on the number of and cost of treatment for those with conditions associated with air pollution each year?
Yes, in a word. Yes, I think that would be very encouraging as a step forward. And I mentioned already that there is a process in place in terms of updating the processes for health impact assessment, and DEFRA are due to update their damage costs as well. So also it would be extremely timely to bring that forward as a recommendation.
I agree.
Thank you. Lovely. Well, Dr. Bartington, Mr. Parks and Councillor Porter, thank you very much indeed for the evidence we've heard from you. It's been an excellent session once again.